Good afternoon and welcome to our daily briefing. We do apologize for being late and we'll just jump into it. Today we would want to delve into a matter that touches on families, including our children, during this period of the pandemic. Health emergencies such as the one that we're experiencing usually result in an increase in violence incidents, particularly among vulnerable groups of women, girls, and children. The increase in violence cases, predominantly gender-based ones, has been witnessed globally, and Kenya has not been spared either. The country has witnessed a 7% increase in the number of all forms of violence incidents from March to June compared to a similar period last year. We have noted with concern that some counties, particularly Wajir, Turkana, Kisii, Nandi, Lamu, Homa Bay, and Kisumu, have recorded a 30% increase in cases of violence since the beginning of the pandemic. Worse still, and this really is a shocking statistic, close to 5,000 rape survivors have received medical treatment in health facilities during this period of the pandemic. Children below 18 years bear the greatest burden, as they comprise of 70% of these survivors, with 5% of these survivors being male. Ladies and gentlemen, some people say the measures that we have put in place for the purposes of curtailing the spread of coronavirus disease may have contributed to the aggravation of this violence. And it is important that we point out that these measures do not at all justify any violence being meted out on innocent members of our society, more so women and children. Measures such as movement restrictions, which have been in place and have since been lifted, the disruption of social networks, the loss of income, were all meant to address the COVID-19 pandemic and not intended to trigger or indeed become an excuse for any form of violence. Unemployment, the inability to provide for families, the economic uncertainty that we are facing may have added extra strain and heightened anxieties amongst families. However, again, we do repeat that this is not an excuse to meet any form of violence. And it is in this consideration, in terms of the issues that we've laid out, that we have instituted a raft of measures to mitigate against social upheavals and to continue to encourage members of the public to ensure that they take advantage of these measures to cushion themselves. We are concerned with this violence because of its devastating consequences, such as the serious physical, mental, sexual, and reproductive health problems that are often associated with such violence, in particular, sexually transmitted infections. And remember, I just mentioned 5,000 recoveries just in the past few months in terms of rape, HIV, unplanned pregnancies, all ill side effects of this violence. And so we do continue to urge members of public to again be each brother's keeper, to ensure that we are working together, protecting each other, protecting our children, protecting our women, and our men in the society. Of particular interest and note is that the National Prevention and Response Plan on Violence Against Children, 2019 to 2023, was launched just last week by the State Department of Social Protection, and this was quite timely. And this document will be able to address issues related to violence against children, including the strengthening of different support services, of particular, launching and setting forth a toll-free reporting line, offering psychosocial support and counseling that is available, and of course the use of 1190 as a toll-free line to be able to report any case of violence or abuse. We would like, of course, to appreciate the efforts of partners who've made this possible in terms of ensuring that our vulnerable members of the community are protected. And we continue to really ask each and every one of us to be duty-bound when it comes to protecting these members of our communities. On the part of the ministry, we have provided guidelines for healthcare workers to be able to offer trauma services for the injured patients, including victims of violence during this COVID-19 pandemic. Recent studies have shown that victims of violence are often unwilling to go to health facilities, especially because they may fear contracting of COVID-19. And so we want to continue to assure Kenyans that our health facilities are well prepared to provide services to victims of violence, while at the same time ensuring that one is protected from being infected with COVID-19. We continue to urge our healthcare workers to be sympathetic to victims of violence, including gender-based violence, by ensuring that they manage both the physical and emotional and mental trauma that these victims often experience. And on the other hand, it is important to note that while we may be ready at the facility level, while our healthcare workers may be ready, it becomes important to ensure that we use the approach of prevention is better than cure when it comes to violence. And so again, activating our community health structures, activating the Ngao structures, activating our communities, our churches, to ensure that we really do step in to be able to protect the vulnerable in our communities. Turning on to the COVID-19 situation, today the news is not any better. Today is the day that we have actually recorded the highest number of positive cases since this pandemic struck. Out of the 6,754 samples tested in the last 24 hours, we have 796 people having tested positive for this disease. And this brings the total number of positive cases in the country to 15,601, pushing our cumulative sample size so far tested to 200,061,027. From these cases, we have 3 foreigners, we have 503 males, 293 females. The youngest is 1-year-old infant, while the oldest is 87. And I feel it becomes important to emphasize today, while we do have the 796 cases reported today, 89% of them are asymptomatic. And that's important to note. 89% of them are asymptomatic. Again, leading to the emphasis that we've placed that this disease is really well within our communities. Again, to place the emphasis that, any one of us could actually be afflicted with this COVID-19 disease. In terms of distribution by cases by county, Nairobi has the highest at 539, with a positivity rate of almost 13%. Kiambu 63, Machakos 57, Kajiado 37, Migori 26, Kericho 15, Narok 11, Uasin Gishu 11, Laikipia 9, Nakuru 7, Busia 6, Mombasa 4, Kisii 3, Murang'a 2, and Siaya 2. Embu, Kisumu, Nyeri, and Trans Nzoia all have 1 case each. We have provided a distribution in terms of sub-counties, but to provide highlights in terms of Nairobi, Kibra continues to lead with 64 cases, Dagoretti North with 55, and Embakasi East with 40. In terms of Kiambu, we have Ruiru leading with 17 cases and 9 in Thika. In Machakos, 50 of them, the cases come from Athi River. In Kajiado, we have Kajiado East having 23 cases. In Migori, we have Kuria West having 19 cases. And in Kericho, we have Ainamoi having 14 cases. Narok West leads with 6. Whereas in Laikipia, we have Laikipia West leading with 6. In Busia, we have Teso South leading with 3. And in Mombasa, Mvita leads with 3. Kisii, all the 3 cases are from Kitutu Chache South, whereas Embu, Kisumu, Nyeri, and Trans Nzoia all have 1 case each. The good news is that 378 patients have recovered from the disease. Out of this number, 199 are from the home-based care program, while 179 are from various hospitals, bringing the total number of recoveries to 7,135. And we continue to salute our healthcare workers for this commendable work that has enabled us to achieve these results. Sadly, we've lost 3 patients from the disease, bringing our total fatality to 263. And in aggregate form, we stand at around 1.7 case fatality in the country. We do want to pass our sincere condolences to the families and friends of those who've lost their loved ones. And finally, we would like to make a special appeal to you Kenyans to ensure that when you do feel unwell, that you visit the healthcare facility immediately. In the past few days, we've received several reports, reports shared with us online, calls of patients who perhaps are afraid to now seek care. And we are witnessing cases where people are rushing to hospital at the last minute. And then, of course, succumbing to the condition because we've not been able to intervene at an appropriate time. So we do request you, really, to seek care should you feel unwell, to be able to approach the health facility because it is detrimental if you come in late. Thank you. Questions?